Hi everybody, I'm LeAnne Starr. I'm a psychologist who works with older adults in long-term care, and today I specifically want to focus in on assisted living facilities. I feel like there's a very clear change that needs to occur within assisted living facilities that I think Governor Polis and our lawmakers could attend to fairly easily, and that is the staffing levels. State Colorado regulations for child daycare. We actually have a law for child daycare where obviously kids need assistance with activities of daily living, toileting, dressing, eating. When it comes to child daycare, 6 weeks to 36 months of age, the ratio is 1 to 5. 1 caregiver to 5 care recipients. For 3 to 4-year-olds, it's 1 caregiver to 10 care recipients. When I called the ombudsman to find out what is the rule and regulation and law in the state of Colorado for assisted living residents, it basically is that there is no exact ratio required. Instead, it is left up to the facility to determine how many staff are required to adequately cover the needs of the residents. This may sound very unprofessional, but I'm a direct person, and I'm going to say that's like putting the monkey in charge of the banana boat. I feel like we have got to look at the assisted living population. These are not just older adults, but they're older adults who need ADL assistance. They have dementia, traumatic brain injury, diseases like MS, Parkinson's, Huntington's, disabilities like sensory loss. They are wheelchair bound, histories of stroke, in addition to a lifelong of mental illness potentially, PTSD. You have so many complications that add to the difficulty that actually I feel like they need a lower ratio than what even daycare provides. We need that minimum staff ratio. Residents that I regularly interact with complain that their staffing is so low. I was at a facility this morning and I had 3 different clients tell me that, and this is about a 90 patients in assisted living at this facility, 2 to 3 staff, and they weren't quite sure because they don't know exactly who all's on staff. 2 to 3 people for 90 residents. I don't think that they can meet the need. And what that does to the staff. The staff are overwhelmed, burnt out. The shortages lead to not just lead to the turnover, there's a lot more reasons for turnover, I understand that, but this does not help. The fact that we have such turnover when the relationship with an older adult matters. That's when we know if they have delirium because we've seen a dramatic shift from what's normal for this person. But if there's so much turnover, we never know that. And so these people get sicker and sicker, and why don't we care? Why don't we set a law when we have a law for daycare? Why is it so difficult to have a law for older adults? The well-being, the medication mistakes that occur that I'm told about, the long wait times, a person's left on a toilet for 45 minutes, and it's not the staff's fault, it's because the corporation, who charge anywhere from $3,000 to $7,000 or more a month, are making bank on the backs of these older adults and these staff members. That, to me, is financial exploitation of a vulnerable population, and it happens all the time and we do nothing about it. That is bothersome. We can change it with a simple law that is similar to daycare. And I'm sure other states have a law that is similar about staff to resident ratios. Virginia tried to pass it for nursing homes, and some lobbyists threw out that, it's not a one-size-fits-all program. I'm sorry, lobbyists need to back up. This is about people, this is about humans. This is about caring about the staff who are trying their best to meet the needs of their residents. But when you don't have enough staff to do that, you are going to burn out both the caregivers, the care recipients are going to suffer, and that leads to messages of, we don't really care, you don't really matter. And when somebody has low self-worth or has struggled with depression, anxiety, PTSD, and they continually receive a message that you don't matter, that doesn't help their behavioral or mental health. That leads to acting out, to disruptions, to all of the things that staff struggle how to cope with, and why our older adults are suffering. I've listened to a lot of testimony and have kind of listened to people, and several people said, follow the money. Where's the money? Well, follow the money. What are we doing? $3,000 a month at a minimum. Where is that going? And you have 90 plus residents in a facility, but you can't hire enough staff? And again, I walk into a facility and I see a lot of staff in the nursing station that maybe aren't well trained to get and meet the needs of the older adults. We have to collaborate. We have to help not only the caregivers, but the care recipients, and we can do it as a team. And it is a simple law that would have to be passed. If we do it for children, why can't we do it for older adults?